Namaskar, good morning. Today we're going to talk about a subtle aspect or a part of rhinoplasty or nose job, which is technically called as alar plasty or alar reduction. Why this particular topic? Because we're getting a lot of inquiries from our viewers from across the world, especially from India, that they want to know the difference in these techniques, the costing, the recovery, the healing, and so on and so forth. So Dr. Priya has got some of the questions from the subscribers and other patients who are asking these doubts. I will try and answer to the best of our ability. I hope it's going to be useful. So stick around. Right.
Thank you, doctor. We have a culmination of the most asked questions or popular questions from our viewers. Firstly, what is alar plasty? The term alar plasty, what does it entail?
Yeah, so alar or the ala is like the wing, or it's the base of the nose. This is that part of the nose we're talking about. Any plasty is a plastic surgery procedure that is done to alter the shape, either to increase or decrease. That's what you mean by saying plasty. So alar plasty is a procedure on the ala, which is basically this part of the nose that I actually mentioned. It's that shape that we're going to change by means of any surgery is called alar plasty, otherwise called as alar reduction or nostril shape alteration, whatever it is. It's got a few names, but we tend to go with the name alar plasty.
Okay.
Right.
What is alar plasty, or how is alar plasty different from rhinoplasty? So it's alar plasty versus rhinoplasty. Is it the same? And if not, why so?
So this is very simple, The nose is from the radix to the tip, and from the alar, the columella and the alar. That's the nose, including of course the nasal bones and everything. Alar is just that small part of the nose. Hence, alar plasty is definitely a type of rhinoplasty, but rhinoplasty is a wholesome nose surgery, wherein I could alter the tip, the width, the height, the radix, the columella, relation of the columella with the lip, the projection of the nose, the length of the nose, the width of the nose, and so forth. When every aspect of the nose is addressed, even if the septum is addressed, then we tend to call it as a septorhinoplasty or a rhinoplasty if you don't address a septum. When we augment the nose, augmentative rhinoplasty. Alar plasty is a part of rhinoplasty generally, or in some of the subtotal of the patients that seek rhinoplasty, just an alar plasty can be done, which is the sides of the nose. So this is probably about 25% or 20% of the overall nose job, if you want it that way.
Okay. Another very popular question is it a daycare procedure under local anesthesia, or will the patient need to stay here and it's a general anesthesia procedure?
Very pertinent one, yeah. It's usually a daycare procedure. I would not say that every alar plasty is daycare. The reason is because I also do rib harvest sometimes for alar plasty. Yeah, there are a lot of things with alar plasty. Hence, not all alar plasties are daycare and local procedures, but predominantly a lot of them are. But when I make the incision, when we trim off the excess, when we try to narrow the nose, we can also put some struts inside to give some extra bolstering effect for the nose. So to answer that question quickly, yes, it is pretty much a daycare procedure, and so most often it doesn't need general anesthesia. We could do it under local anesthesia, and I'm sure the next question, or one of these questions, is also about costing. So obviously it's understandable that if you're doing just 20 or 25% of the whole nose job, the costing cannot be the same as well. Now we have an executive here who's taking care of the costing for us exclusively, because of want of time and because of want of follow-up and because of wanting to have things streamlined. So I think it's pretty much about $1,000, but don't take my word on that. That's about the rough estimate, including everything. So about 75,000 rupees, includes your 1 day of stay here if need be, your medication, surgery and everything. But just trying to give you an idea about the costing, not a precise costing, because costing varies for various reasons and I'm not into that totally, but it's just for my subscribers, just for people to get an idea. I told you already it's about 20-25% of the nose job as well. So that gives you a good idea about time frame, about how it's done, what it is, and most importantly the costing. Right, what else?
Doctor, very frequently asked question, can a broad nose or a fat nose can be trimmed by alar-plasty alone?
Yeah, so to answer it in a line, I think the answer is no usually. But there are certain types of noses which we call as Asian noses or South Indian noses or whatever noses, where the projection is good but just the width is a bit too much. Those are ideal candidates for a stand-alone ALR procedure, for a stand-alone ALR resection and reconstruction or ALR plasty. So when a patient has a wide nose, not necessarily all of them just will need only ALR plasty, but a small subset of those patients might benefit significantly out of an ALR plasty. How do you know that you just need an ALR plasty or you need a full-blown nose job or a rhinoplasty? I think you got to contact us. We give you our WhatsApp number. Please be patient with our numbers because we're getting flooded with too many messages. We're going to get back to you, but message us with your pictures and ask us if this is something that could be beneficial for you.
How painful is alar-plasty?
Less painful compared to rhinoplasty. In fact, hardly. Pain is a very it's very minimal, I have to say. Simply because we're not touching the bone. It's usually just a soft tissue, sometimes a cartilage. And so it's done in local anesthesia. You're just going to get a small ant bite kind of a pain when we put the injection, and then it's numb after that, so no pain. So really pain is going to be very less.
The last question is a concern, stating, is alar-plasty permanent?
Yeah, it is. It is permanent because we are excising, we're usually altering the shape of the alar and moving into a new place. I have to at this point also mention about the muscle that's beneath the alar. So there's a muscle called transverse nasalis and other muscles that we also work on, especially for patients who have deep nasolabial grooving. So if you have deep grooving, and then I can correct that a wee bit, sometimes even significantly, by approaching that through the alar. So alar-plasty can also improve your middle third look. This is your middle third of the face. You can tighten this area of the skin, this area of the skin. If you want this area to be tightened, you'll have to go for a lower eyelid blepharoplasty. But on this aspect, alar-plasty does help. So I think you pretty much have got an idea about what this alar-plasty is. Do we have any more questions before I wind it up?
The cost, you did mention about it,
Yeah,
doctor.
I did tell them.
Also a question about the indication. Who can be a right or the ideal candidate for alar-plasty?
So I already mentioned that not all noses are suitable for alar-plasty. Now, having said it, there could be a patient that would benefit, let's say 80% or 90% augmentation, improvement in the nose or the nasal aesthetics by undergoing rhinoplasty or a nose job. But if they go for alar-plasty, you might get 30% improvement. So there still might be an improvement. There are also some patients where it's not an indication. So this is something I won't be able to tell as a rule, because rhinoplasty itself is a surgery of millimeters. It's a finesse surgery. It's a highly cosmetic surgery. So I definitely will require you to come for a direct consultation. But since we are really one corner of this world, you can get in touch with us by social media. We have online video consultations via WhatsApp. We're busy, but we still do our best. But you can send in our pictures. We do a gratis consultation if it's just a message servicing on WhatsApp. But if it's a video consultation, there's a small fee attached. So you can do that and we will tell you clearly as to what would be the best procedure once you and I, or once we are the same page, and then you could go ahead and schedule an appointment for surgery or whatever that is.
Thank you, doctor. This sums up most of our frequently asked questions on alarplasty.
Alright, so I hope that was useful, guys. If you have any more questions on rhinoplasty, alarplasty, septoplasty, you please ask us. We'll try and bring it up again in one of our next videos when time permits. I hope this was useful. Take care and happy Republic Day. Bye-bye.